Building upon the long collaboration between Siemens Medical Solutions and Mayo Clinic, Siemens has again selected Mayo Clinic for the first U.S. installation of its new dual-source CT system called the Flash. The Flash utilizes two X-ray tubes, that's why it's called dual CT, and it offers several unique advantages for our patients. Principally, it's going to help with radiation dose reduction. It can really dramatically decrease radiation dose, especially for cardiac patients. It will also scan faster. Secondly, it helps us scan in a dual energy mode. And we can do this really for the first time in patients of all sizes and for all body parts. That helps us to identify and classify medical diseases to a higher extent. The third is that it really offers an unprecedented opportunity to individualize the CT scan for each individual patient. We can adjust the acquisition parameters, the post-processing parameters, or the images that we create, as well as our interpretation methods, depending upon the symptoms that a patient may have, the reasons that they're referred to us, and even their body shape and size.
The Flash scanner is a very patient-friendly system. It can stop motion of moving objects, and so sedation of children will not be necessary. It also builds upon our long-standing practice of reducing dose for children in that we can dial down or adjust the dose to the specific patient from a newborn up to a larger patient.
One key point we'd like to make is how flexible the Flash CT scanner is. In addition to having all the capabilities of previous CT scanners, this scanner is so fast that it allows us to freeze cardiac motion, allowing us to image the entire coronary artery tree in a single heartbeat. This is the first multi-detector CT scanner that has that capability. For certain patients, those with high or irregular heartbeats, we may even be able to avoid the use of cardiac medications such as beta blockers to reduce the heart rate. And in other patients, patients in whom we can give beta blockers to, we can often lower the radiation dose by up to a factor of 10 as compared to conventional cardiac CT scanning.